Hello all. I think the main purpose of, I think the best thing for me to do is actually to share with you some of the stories of people who have come to an impact and how we have been able to help. I will read from notes, so if I look down, that's what I'm doing. So the main purpose of a benefit impact is to improve the financial position of the people coming to an impact. So I will share with you some of the success stories we had at these impacts, with the details a little obscured for the sake of privacy. There was the New Zealand super client who was unaware that they could apply for assistance with their rental costs and who hadn't been told this by Work and Income. We were able to assist this person to apply for both the accommodation supplement and temporary additional support, which increased their finances by over $80 a week. Another person was also not receiving the accommodation supplement, even though when they asked for a breakdown of their benefit payments, it was identified by Work and Income they should have been and how much. On further looking into this, we found that they had been in receipt of this assistance, but it had been suspended some years back. And even though the person had tried to communicate this, nothing was done to correct the error. We were able to get the assistance started again and backdated to the time it's suspended, which meant a backdate of over $2,500 and a weekly increase of $20. Again, we helped a person who, due to a break from being on benefit, had been returned to a benefit, but was not being paid the one they thought they were and were eligible to receive. This took a bit more time and required follow-up after the impact. The correct benefit entitlement was eventually sorted and backdate paid. The weekly benefit that should have been paid was the benefit for people with a long-term medical condition that meant they could not work full-time. The difference from this benefit and the job seeker one that they were receiving is currently $58.15 a week. Another couple came to the impact and we identified they were not getting the disability allowance. We raised this with the case manager, who told us the people had a support person who helped them with their benefit, and the case manager contacted the support person and was meeting with them to get the disability allowance up and running. The maximum disability allowance is $66.11 weekly, dependent on the verified costs, and that's for each qualifying person. A young mum was asking for help to buy a cot, but because of a misinterpretation of the policy, was told they couldn't have help to buy a cot, but could have help for cot blankets. We looked into this and were able to show that this was not the case and the cot could be included, which it was. Another family had several health issues, the parents as well as the children, which meant they were struggling to meet their everyday living costs of rent and food. The volunteer advocates were able to work with them through the issues and access the disability allowance for the parents and extra support for the children who were entitled to the child disability allowance, which is a payment of $49.83 weekly for each child who qualifies. This increased their finances considerably and made access to extra health-related care possible. Not all people who come to the impact have their benefit changed, but we are able to show them what they are getting and why they are not eligible for further assistance. We worked with one person, and after accessing all the irrelevant information, we could explain that he had assets worth more than the cut-out points for accommodation supplement, which is $8,100 for a single person. We were able to give him the figures he needed and to let him know when he would be eligible for the assistance. He was satisfied with this and was less confused now that he was better informed. The added advantage to an impact is that the volunteers who may have had no previous understanding of the benefit system and its complexities and limitations become aware of this first. It also can help to give a snapshot to work and income case managers in regard to some inefficiencies, such as proactive communication, gaps in policy and legislation knowledge that impact on people not receiving FACE, that is, their full and correct entitlement. Thanks for hearing this, and back to you, Matthew.